PTSD or not PTSD? That is the question, and that's what we're going to examine today. Hi, I'm Kim Long, and I'm with Dochas Psychological Services in Spruce Grove, Alberta. So before we go much further, post-traumatic stress disorder is a very real, destructive disorder. If you or anyone else in your family have been diagnosed with it, then you know the ripple effects that it can have in your family. And so this video is not meant to help people self-diagnose or anything like that. It's just meant to clarify some information. The other thing that I'd like to go over is just because you don't meet the criteria for PTSD, it doesn't mean that you haven't experienced trauma. Trauma to me is anything that occurs where our system and our normal ways of coping have been overwhelmed to the point where we feel powerless or I want to say traumatized, but you can't use the word in the definition, but it's just like your life has been significantly altered because of it. And it's simply because your strategies were overwhelmed. So that means a lot of us have experienced trauma. But for whatever reason, for some of us, the event can sometimes create some long-lasting impacts. So anyway, to clarify, just because you haven't been diagnosed with PTSD or you don't meet the criteria for it, it doesn't mean that you haven't experienced something significant. And our DSM-5, which is this big, huge book right here that we use for diagnosis, actually has a whole section called trauma and stressor-related disorders that account for other ways that people can experience trauma without meeting the criteria of PTSD. So I just want to make that clear. It doesn't minimize what you've experienced in any way just because you don't receive the diagnosis of it. But to clarify, so for PTSD, it has to be a physical threat. If you haven't experienced a physical threat, then it's not PTSD. So to clarify, in the manual, that's like lifting weights. I don't even know if that shows up right way around for you, but basically in the manual, they give us a whole breakdown of what needs to be met. Criterion A says, the person has to have experienced exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways: directly experiencing the traumatic event, witnessing in person the events as it occurred to others, learning that the traumatic events occurred to a close family member or close friend. In cases of actual or threatened death of a family member or friend, the events must have been violent or accidental. And then experiencing repeated or extreme exposure to aversive details of the traumatic events. For example, first responders, police officers. It does not include repeated or extreme exposure to aversive details of traumatic events through television, media, anything like that. It doesn't include it. So why did I read that to you? Because if you don't meet or your loved one doesn't meet criterion A, it's not PTSD. It has to be some sort of physical threat. Then after that, we have other criteria that we have to meet. We have to meet at least one symptom in the intrusion symptoms. These are things like where it just kind of pops into your head and you didn't want it there and you weren't even deliberately thinking of it. Category C, you need to have one of these avoidance symptoms. Category D, changes in the way you think and in your overall mood. You have to have 2 symptoms from the list. And then category E, changes in emotion, where you're more angry or you're more sad, kind of hair trigger emotions start to show up, and you have to have 2 from the list there in order to, again, meet the criteria for PTSD. As mentioned at the beginning of this video, I think, this is this has been coming up a lot more, and I think in some cases people are getting the label of PTSD and they don't actually have it. You might, or your loved one might actually have one of the other trauma or stressor related disorders. It might be depression, it might be anxiety, it could be a lot of other things. And that's where you need to go to a licensed professional to try to filter out what is actually going on so that the treatment plan can be appropriate for you. Now, again, I want to reiterate, PTSD is a very serious diagnosis. It's one that affects a lot of people and has ripple effects throughout the family. Given all of the different ways PTSD can affect you, by avoiding things, by changing your personality in a lot of ways, the way your personality presents, it's a diagnosis that needs to be treated with care, and by someone who has a background in it, in my opinion. So again, if you have any questions or concerns about how PTSD can affect you or your family, or just more questions about the diagnosis, you can contact us at info@dochaspsych.com or through our website, www.dochaspsych.com. And if you liked this video and would like to see more of them, just hit the subscribe button below, and I look forward to connecting with you. And my thoughts are with you if you or a loved one are struggling with a trauma or stressor related disorder. Take care.